Hello everyone, this is Chadi Alraies from Arch 2023. I'm really privileged today to be with Sam Conaway, who is US President of Sales of Boston Scientific. Sam, so pleasure to see you, and also to listen to your phenomenal talk this morning, very inspiring about equity in healthcare.
Yes.
So sounds like a near and dear topic to you. So where did you start?
Yeah. So Chadi, I, have been doing this work for well over 25 years. But really where it started was I had an uncle who was my favorite uncle, and I had done my senior project because he was an air traffic controller. And, back in the early 80s, there were not many African-American air traffic controllers, and I adored him. He was a chef, and he always invited us to his house. He had a nice house. We lived in the hood, but he died suddenly. And he was 52 years old, and it really just kind of shook me up. And so I ended up getting into healthcare in a roundabout way, but really having that incident happen made me very passionate about health equity.
So we are now in day and age where this topic, fortunately or unfortunately too late, we are coming to be aware of.
That's right.
What is the reason for this lag in being aware of it?
Yeah, I think we have always talked about this.
Yes.
And it's been a lot of talk, statistics, numbers, data, but where we're moving now is to action. And we're actually doing some things about that.
You're right.
And so you saw that the FDA is requiring all the medical device companies to have performance goals for their clinical trials. That's where it starts, because if you think about it, when you're sitting down and talking to a patient, and a lot of the drugs or the devices that they've studied, 2%, 3% of the patients are people of color or women. Why would you be interested in putting that in your body? But if you can sit there and say, listen, we have studied 40% of the patients that are like you, and it worked really well, that's a difference maker.
Exactly.
So now it's all about action.
Yes. So speaking of trial, you are moving to a very important topic, which is trial recruitment. I am a physician in Detroit, and 90% of the population we treat is people of African American. Health access, socioeconomic status challenging, and when we offer them Watchman, as simple as Watchman is becoming standard of care for people, obviously, there's a lot of hesitation from the family to use it. And I think this comes timely now, but I don't think it's going to be anytime soon. It's going to take some time. Do you agree?
I agree with you. It's interesting you bring this up, because one of the biggest areas that we need to work on is how do you talk to a patient of color.
Yes.
And we actually did this work many years ago in defibrillators, and that's how Close the Gap actually started, was that we had a lot of patients that qualified for a defibrillator. If they were African American, they didn't take it.
Yes.
And it was the way that the physician spoke to the patient, and using words like, if you have 3 or more PVCs, we're going to, look at, the algorithm, and then we're going to, send.
Go above his head.
They're like, oh, I don't want that.
Yeah.
But if you taught that physician to say, hey, listen, we're just going to put almost like a little ambulance in your chest that's going to protect you. Okay. And it's going to help you stay alive.
Yes.
Oh, that's a different conversation.
Yes.
So I do believe that how you talk to patients is very important, and then you have to build that trust with them. And I think it starts with the clinical trials. If you were to say to those patients, hey, we want to give you a device where 50% of the patients were tried in Watchman, I think that's a different conversation.
Absolutely.
Yeah.
Well, Sam, I think you are a pioneer.
Thank you.
As well as a leader. I see you on LinkedIn a lot, especially with the Close the Gap. What you are started is phenomenal, and I think leading us in the right direction finally, of closing the gap on minority, diversity, and equity, and give equal health and access to health to everybody we treat and touch.
Yeah, that's what we want to do. And this is not about calling people out. This is about making people aware.
Yes.
Right. And then if we can change this, which I know we will, over time, it's going to be fantastic, not only for patients, but for every society.
Thank you so much, Sam.
Thank you.
Please watch this video and others on Arch YouTube channel. This is Chadi Alraies from Arch 2023. Sam, thanks so much.
Thank you.